Vasant sir, good afternoon.
Good afternoon, sir.
Sir, another 5 minutes will start, sir. Just we'll wait for
2 ಗಂಟೆ ಅಂತ ಹೇಳಿದ್ರಲ್ರಿ ಸರ್, ನಾ ಊಟ ಮಾಡೋದು ಬಿಟ್ಟು ಕುಂತೀನಿ.
5 ನಿಮಿಷ ಸರ್.
ಅಮಾವಾಸ್ಯೆ ಪೂಜೆ ಅಂತ ಹೇಳಿ ಪೂಜೆ ಮಾಡಿ ಬಂದು ನೀವು 2ಕ್ಕೆ ಕರೆಕ್ಟ್ ಅನ್ಕೊ ನಾನು ಊಟ ಮಾಡಿಲ್ಲ. ಇದು ಸೆಷನ್ ಮುಗಿದ್ಮೇಲೆ ಊಟ ಮಾಡ್ಕೊಂಡ್ ಬಿಟ್ಟೆ.
ಅಲ್ಲ, ಒಮ್ಮೆ ಇದು ಪಂಚಕರ್ಮದ್ದು ಊಟ ಮಾಡ್ಬಿಡೋಣ ಅಂತ ಎಲ್ಲಾರು ಸೇರಿ.
ಅದೇನ್ರಿ ಎಲ್ಲಿ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ರಿ ಸರ್.
ಆಯ್ತಾಯ್ತು, 5 minutes.
ನೀವು 2ಕ್ಕೆ ಅಂದ್ರಲ್ಲ, ಶಾರ್ಪ್ 1:50 ಅಂದಿದ್ರೆ ನಾನು
ಇಲ್ಲ 2ಕ್ಕೆ ಮಾಡ್ತೀವಿ.
ಸರ್
ಮಾಡ್ತೀವಿ 2-3 ನಿಮಿಷ.
ಡಾಕ್ಟರ್ ಚೈತ್ರ.
Yes, sir.
Did you made me ghost?
Yes, sir. Yes, sir.
Okay.
Om Guru Brahma Guru Vishnu Guru Devo Maheshwaraha Guru Sakshat Param Brahma Tasmai Shri Gurave Namaha. A very good afternoon to everyone. Myself Dr. Chaitra, final year PG scholar. On behalf of the Department of Panchakarma, Taranath Government Ayurvedic Medical College and Hospital, Ballari, I warmly welcome to our respected principal Dr. Janaki Vyas ma'am, distinguished guest speaker Dr. Vasant C. Patil sir, and our respected HOD Dr. Santosh L. Edali sir, esteemed faculty members, postgraduate scholars, and all participants joining us for today's webinar on emerging research trends and instrumental innovations in Panchakarma. This topic represents the evolving advancement in Panchakarma research, and we are privileged to have an esteemed scholar and clinician to share their valuable insights with us. It is now my great privilege and honor to introduce our distinguished speaker, Dr. Vasant C. Patil sir. Sir is a renowned Ayurvedic physician, academician, researcher, author, and publisher with over 23 years of clinical experience and 18 years of academic and research experience. Sir completed his UG in SVM Ayurveda Medical College and Research Center, Ilkal, MD in Panchakarma from IPGT and RA, Gujarat Ayurveda University, Jamnagar. Sir is the director of Atreya Ayurveda and Panchakarma Center, Hubballi, director of Atreya Ayurveda Publications, executive editor and publisher of the Scopus Index Journal of Ayurveda and Holistic Medicine, JAHM, and director of Vayodanta Biotech Private Limited. His expertise includes Panchakarma, clinical research, neurological and musculoskeletal disorders, Rasayana therapy, and evidence-based Ayurveda. Sir has authored 15 plus books, published 55 plus research articles and editorials, reviewed 300 plus manuscripts, and guided multiple MD and PhD research projects. Sir has contributed to
trends and instrumental innovations in Panchakarma.
Standardization initiatives through BIS and WHO benchmark activities, developed innovative Panchakarma devices, and worked as an investigator and consultant in Ayush-funded research projects. Sir is a respected national and international speaker and resource person who has delivered lectures on Panchakarma, research methodology, Ayurveda education, and evidence-based Ayurveda, contributing significantly to the advancement of Ayurveda through clinical practice, research, and innovation. We are honored to have such an accomplished clinician with us today. With these few words, I now request our esteemed speaker to kindly commence the session. Before we begin, I kindly request all the participants to keep their microphones muted throughout the session. Participants are requested to post their queries in the chat box, which will be addressed by the speaker at the end of the session. Over to you, sir.
Bhagwan Dhanvantriye Namaha. Om Shri Bhagwan Punarswatrayaya Namaha. Good afternoon to everyone. So today's topic, quite interesting, that is the emerging research trends and instrumental innovations in Panchakarma. So if you see, I'm going to speak regarding the research, how it is happening in India at the level of government, CCRS, academics and NGO, as well as and university level academics, how it is how the guides are guiding, and as well as the students are doing research. Everything I'm going to talk today. So before that, I will start with introduction. Recent advances in clinical trials, biomarker-based studies, few studies, and omics technologies, gut microbiome research at few centers, little bit it is going on. They have expanded the scope of Panchakarma research. Current research focus on establishing and evidence-based clinical applications. Emerging trends seek to integrate classical Ayurvedic principles with contemporary biomedical science to enhance global acceptance and improve in today's modern age. Global advancements in science and technology have sparked a captivating and splendid revolution. This pervasive transformation is inescapable, captivating the attention of influence. This imperative arises from the teachings of Maharshi Vagbhata, who emphasized the necessity of updating and revitalizing the traditional methodologies and technology. I will talk what is the scenario of research as far as the Panchakarma research. See, the government body CCRAS is doing some standardization work, all those things, all the Panchakarmas they have done. So I have also attended around two. One is Basti Karma and another one is Virechana Karma. Okay. And while opinion between the Chaturthi, one is different and NI one will be different. And after that, the scenario is that they are not publishing. It is not available in public domain. That is the bad thing. they are practicing. So at least the young budding Panchakarma scholars has to get access to the what is done. If it is successful, how it becomes successful. If it has failed, what are the reasons for failure? They have to identify. At least they can able to identify young budding practitioners or the young budding scholars. They can the workshop, standardization workshop, he will laugh. He will laugh at me. So everyone egoistic nature. Everyone wants their place. Jaipur available. It is we are practicing like this. So no one listens to. There is no shastra based rationalize there. Still, they are conducting something. They are coming out with some points and something they are doing, but it is not up to the expectation. What they are spending, the amount, the time of the experts, everything that is going in vain, just like washing of tamarind in the water. What I experience, I am telling you. Then coming to the academic research. So at a national level, all these IA, NIA, Jamnagar, they are doing. Still, they have to do some more rigorous by integrating with IIT and AIMS, etc. Then only we can able to achieve what we are going to be expected from the young budding scholars. That is my thing. And with heavy pain, I'm saying this. RGHS, coming to the RGHS, our university. So for everything, for a drug, for a procedure, for dose, for everything they want reference. It is coming from the old generation, 30 years. Till also today also everyone is following that. Then how can you make innovation? These headless people sitting there, synapse, who is checking, God knows that one. So everyone, they want reference for everything. Then how can you innovate? For example, Ayurvedic is there, Ayurvedic there is no exact dose is there. But for standardizing, if my student, I took the Katishula, it is there. Even though whatever it is there, Katishula, it is there in the reference itself. Still there now, someone is commenting, why you have taken Ayurvedic in the Katishula? So that is the scenario. So why? Because Agni involvement will not be there much in the Katishula. So if you take the Parinam Shula, etc., dural ulcer, the Agni is involved. So the standardization is not possible. So you have to take where Agni intervention is very minimal. Such a case you have to take for Snayana. The same thing in MD, this we took skin disease because there is a least involvement of the Agni, Shodhanartha Abhyantara Snayapana standardization. So I'm just humbly suggesting to all the guides and the young budding scholars, get 100% freedom to do the research. So at least it should have a classical base, no doubt that whichever the karma you are doing, it should have it must have the classical base. And whether it is a theory or concept or practice or principle, okay, it should not be irrational. Then it is permissible, even if there is no reference of that dose, particular dose or practice or method, whatever it is there. So this is the scenario in academics as far as the RGH is concerned. That thinking should be changed. At least our generation, I'm talking, our generation guides, okay, and as well as the students come out from that. Everything you need a reference. Then what innovation, new thing you are going to do? Simply you are doing comparative study, comparative study, comparative study. I am seeing least standardization works in the RGHS. Only under me, Virechana standardization and Avpedaka Sneha standardization and another one, Nasapana standardization and Basti, Vaitana Basti. These 4 standardizations work I took under my supervision. Okay. So always for any research, the fundamental essential is first standardization, SOP, method standardization, dose standardization, device standardization. Without this, if you do research, then it will not be a perfect research. It will be a biased research. Okay. And as far as the NGO is considered, coming to the NGO, after speaking the government and academics, the NGOs like Big Kotekal, SDM, KLE is an institute, not NGO. What they are doing? What is their contribution to the research? Healthcare, no doubt, they are doing at par, high quality world. They are number 1. I agree, and I salute to the STM as well as Kotekal and other such are Sridharin, etc., etc. But what is their contribution to the research? I am directly asking in an open forum now. Okay, they are getting fund for a center of excellence, etc. And what is the outcome? That God knows. So after speaking this, the research trends in Panchakarma introduction, whatever it is there, my opinion I have told, and I also suggested to change your makeup, means change your thinking style of everything. You should have reference for the any research. Come out of that, I'm telling you. Then coming to the instrument, today's instruments, I'm going to tell you our practical experience also. Innovative Katibasti device, I'm going to tell. And what are all the scenarios, what is happening, why the automated devices are not having not demand, as well as the market is very, very low, automated as well as innovative devices. We are going to tell that one also. Okay. To the research publications in PubMed, Panchakarma. If you see total 123 articles, see Omana Virechana Basti, highest is Basti. Okay. Just a moment, I'm just laser I'm taking. See, by this you can say Basti is the most researched Panchakarma procedure. And Nasa and Virechana also shows substantial research activity. Omana articles in past 10 years. Panchakarma 35, out of which 17 are clinical trials. Snehana Upakrama, total 7. Out of which 3 are clinical trials. These are published papers I'm talking. Then Panchakarma, procedure standardization, total results 248. Major themes, these are the things. Scopus. If you see Omana 107, Virechana Scopus articles, Nirovasti Scopus articles, Anvasanavasti, and Nase. So, which are the emerging research trends? There is a gradual, what the observation from the following data, we can say there is a gradual increase in randomized clinical trials, growth of evidence-based Panchakarma, expansion of interdisciplinary collaborations, emphasis on procedure standardization, rising international publication with laboratory and physiological research. Few examples. Based outcome assessment, digital treatment monitoring, sensor based Panchakarma devices, systems for selected procedures, global multi-center collaborations. Then international clinical guidelines that should be uniform for all those who are carrying out the research, just like ICMR guidelines. We have to make a clinical guidelines for carrying out the Panchakarma research. The take-home messages are research in Panchakarma is expanding quite rapidly. Basti has the highest volume of publications. Clinical trials dominate current research. Standardization, technological innovations are becoming major priorities. The next decade for this and global. So these are the, if you say in diagrammatically, see, there should be in future, what are the things we have to see for carrying out the research on Panchakarma? You should have an approach, evidence-based approach. There should be a collaboration between interdisciplinary branches, advanced technologies, digital health integration, patient-centered research. That is must. For every research, this is must. Translational research, globalization of research, and standardization and quality control. Innovations in Panchakarma instruments. The second topic which is given to me. So for this, why you need a new technology? So why? Because in order to compete with the rapidly growing global market, there is a need of new technologies and methodologies. These are the reasons why you have to do adopt new technology to make economical or cost effective therapies, to provide standard, clinically effective and safe Panchakarma therapy, to save manpower, to save time. So, which are the general guidelines? First, the procedure should be effective as it should be equally effective as that of classical method told. It should be easy to handle, easy access, economical. It should be safe, having no hazardous effects. So R&D must begin from classical Panchakarma principles, not only from the engineering needs. So for this understanding, SOP is very, very essential. Instrument design should support safe and effective procedure, not merely procedural convenience. Essential parameters: biocompatible materials means medical grade silicone, stainless steel, food grade polymers, etc. for making kadivastering or the other janvastering, etc. like that. And non-toxic and non-reactive with the oils, ghee or decoctions. Smooth edges and ergonomic shaping. For example, Romana Pita, Virechana Pita, Nasya Pita, or Droni, etc. Prevention of tissue injury or cross-contamination. Raktamokshana, etc. Easy cleaning and sterilization. Then safety testing. First, the utmost priorities, our therapies are heat-based therapies. So the first safety concern is thermal stability. Is it it should not cause any burns or fire incidents or fire accidents. Okay. Pressure tolerance, especially for Basti instruments or Nadi Sweda or steam generators, etc. Then microbial contamination risk assessment. In COVID-like situation, Omana, etc. and Basti, these are all very important. Then standardization and reproducibility. One of the biggest gaps in Panchakarma practice is device variability. There is no uniform device. That's why the Bureau of Indian Standards, BIS, Bureau of Indian Standards, has started recognizing this, and they have made standards for Droni and as well as Shirodhara Yantra. In that also, I am the one of the member. Among the three members, I am also one of the member who has contributed for that. Standards of Droni and Shirodhara Yantra. So R&D should focus on standardizing the example. I'm saying Shirodhara Patra example: diameter, length, volume, capacity, flow rate, pressure parameters. If it is automated device, then calibration of delivery systems. Example: Nasya drug delivery system or Basti drug delivery system. You have to calibrate the pressure, calibrate the quantity, calibrate the force, calibrate the drip in case of Nasya, etc. Like that. Dose precision, especially for Matra, Basti, Nasya, etc. So by standardization, what it contributes? It contributes clinical reproducibility. So for research comparability, it is the best. So after this, if you do research, then it will become the most genuine and perfect research, and the outcomes will be uniform. So ergonomics and practitioner utility. So instrument design should reduce operator fatigue and procedural variability. So consider ease of handling, single hand operation when possible, grip stability, adjustable components. Example, Vamana beta, Virechana beta, like that. Then integration with technology. It may be IoT based, Internet of Things, IoT based, or Android or Bluetooth, like that. Integration. Future R&D directions, example, digital temperature monitoring in Sweden. We are going to see in Nadi Sweden, etc. Then pressure control Basti systems, color and consistency detection tools for Virechana outputs. Even pH also, pH, turquoise, everything, all sensors, whichever the sensor you will put, it will able to detect that. You are going to see in that Virechana. Then AI assisted monitoring cameras, for especially this is badly needed for Virechana. Sensors for flow rate and timing. And the team needed for to do the R&D on Panchakarma instruments. First, Panchakarma Vaidya, mechanical engineer, electronic engineer, software engineer, AI expert, if AI integration is needed. These are the must. We will start with some individual Panchakarma, recent advance and techniques in instrument, as far as the instrument is concerned. See the massage table, adjustable, this is there. Then this one is the massage table. Again, it is adjustable. This one is, first one is a simple or non-hydraulic, I think hydraulic. This is multi-purpose droni. This is the Bureau of Indian Standards, which I told I'm one of the expert in bringing out this means standards. So this is the droni table. The first, this one is the vertical top view. This is the lateral view. This is the table. Okay. How it seems. This is also table. So this is droni. So all the Panchakarma scholars, you can get it in net also. Simply put the BIS standards for droni. You can able to download this document. Okay. This is lateral view of droni. This is from top view, and again it is a side view. So the difference, if someone follows, all the companies follows these standards, then they will get the Bureau of Industry, means ISI seal, they will get certifications, they will get BIS certifications, they will get. Okay. For this purpose, this is done. So this will help in quality instruments production marketing also, and why they can able to get genuine instruments, because BIS standards it will not be provided for low quality instruments. Okay. So which are all the standards? Means wood quality or the fiber quality, the recommended steel, etc. Whatever the recommendation is there, if they are following that, then only they will get this means BIS certification. So this will helps in boosting the export. Okay. Again, this is also the same thing, drone. So some tips I would like to give for the Panchakarma scholars and practitioners, that is smart buying options it is. So if you see, first you have to see the wooden droni, wood quality you have to see. No cracks, etc. knots or bending. Then if you go frame and structural stability, then load capacity, it should have minimum 200 kg loading capacity, 200 plus even. Okay. Then you see the design and ergonomics for Kayaseka, etc. Shirodhara. Then oil drainage systems, dimensions as per BIS, surface finish, Customization options should be provided. Then compliance and hygiene, easy to clean the surface. These are all the things the wooden droni must have. Then for fiber droni, you have to have the durable. It should be durable, minimum 10 years. I'm using since 2014. Now almost 12 years over. The fiber droni, nothing as in even a simple crack is not found. It is still having strong durability. Then ergonomic for therapist as well as patient. Both should feel comfort. Hygienic, oil drainage system, dimension, same thing. Only thing here, it should have a wavy surface. Surface finish should be wavy. It will prevent this slipping of patient. That is most important. Customization options always it should be provided. Then coming to the Shirodhara Yantra, this is what we are using for traditional method, mud pot, wide mouth mud pot. This is metallic one. So this is circular wide mouth recommended. This is not recommended. Narrow mouth for illustrative purpose because refilling is difficult in narrow mouth. This is not recommended. This is Shirodhara Yantra Automatic SKM company.
Option, sir. Sir, can you present the PPT in slideshow mode, sir?
Just a minute.
Yes, sir. Yes, sir. Thank you, sir.
Now, is it means
No, sir. It is
completely screen is completely visible?
No, sir. No, sir.
Huh?
Next slide also visible, sir. So it is not in slide.
Okay.
Yes, sir.
So this is also Shirodhara Yantra Automatic. This is this Shirodhara Yantra. See, if you see, is it recommendable? I'm asking to my young budding scholars. Is it recommended? It is not recommended in sitting portion. Okay?
Not recommended.
Always, hello? Shirodhara stand adjustable with wheels. This is Shirodhara Yantra crystal mind. So one France practitioner has developed this. This is cost you can see in web. Swiss patent is there. He has got Swiss patent for this. It is limited to only water. Oil you cannot use in this. And heating provision is not there. Only recirculation continuous is possible here. Continuous flow can be maintained, but temperature and as well as oscillation is not possible. And drip control is also not possible in this. This is Shirodhara BIS standards, Bureau of Indian Standards. See, everything standards means how they will do BIS. For our Panchakarma instruments also, see, this is Shirodhara part. What is the diameter, then height, with everything they will. Even the thread, length of thread, then chain, then complete instrument like this. And this one, you are seeing this. Even the hole which you are doing to the pot, that is also mentioned here. And stand everything, all parts is. This is the metamorphosis of Shirodhara device. From ancient era to the future smart wellness era. This side you are seeing here. So ancient era mud pot. This is steel one. So then the stand is improvised, and as well as then advanced era automatic, semi-automatic, and then automatic also available nowadays. But still nobody has done this smart wellness, means Android controlled or IoT integrated. This we have to do. This is the challenge for all the budding scholars. So which are the guidelines for future innovations? It should be fully automatic, portable, remote controlled via Android device or Bluetooth. Android is must. Through the mobile you can control. Why they can control? Just you set all the temperature and the amount of liquid needed and the time, 45 minutes or 1 hour, start time, end time. Then automatically it will switch off after the finish time, and the message will be, there will be alarm to the Vaidya. Okay? Like that. Smart buying recommendations for Shirodhara vessel should be wide mouthed. Wall must allow fine drip control. Controllable. Vessel weight balanced. Metallic chain should be strong. Capacity minimum 2.5 to 3.5 liter. Shirodhara stand should be strong. Okay. Smart buying recommendations for fully automatic. There should be a auto circulation pump. Noise should be zero. Digital temperature control should be there. Programmable flow. Timer automation. Oscillation control. What I told. So this is next generation Shirodhara system. Okay. So in this you are seeing first it should be precision flow control plus or minus 5% accuracy. Okay. Then closed loop temperature regulation. Temperature regulation without there should be a provision to prevent the overheating. Okay. Multi-point temperature sensing. Oscillation pattern programming. You can adjust oscillation or single point. Both you can, means 15 minutes oscillation, 15 minutes single point. Like that you can able to adjust that. Then digital monitoring interface. So temperature, flow rate, oscillation pattern, and session timer. All these things you can able to control. Then portable compact version. IoT enabled remote diagnostics. You can track pulse, BP, respiratory rate, and even the body temperature, basal metabolic weight. If you integrate with easy, it can able to directly provide the easy live. Okay. The programmable therapy protocols, smart reservoir oil. These are the few I am telling you. Infrared skin temperature mapping. If you have infrared sensor, then it can able to automatically control. If the body surface temperature increase, automatically it will decrease the temperature like that. Then touchless and hygienic control should be there. And last, ergonomic head positioning system. The head positioning is very, very, very important. Otherwise, cervical spondylosis will occur if properly there is no proper position of the patient. And patient safety cutoff system should be there. If something electrocution occurs, means automatically it should off. Okay. These are Akshitarpana Yantra, swimming goggle modified, oil eating machines, Kativasti instruments. Kativasti device, it is nowadays available, I don't know. So when we researched 5 years back in the internet, we got this. So this is very bulky. If you see, table where they have kept the device and the rings are attached to the knee. So the heated oil is circulated to this. And when it will cool down, again you have to start, those recirculation occurs. So this is the mechanism. Its cost is also very high and human intervention is needed. Every time you have to switch on, switch off everything and temperature you have to check. Like that, it is not much use, and so that's why these type of instruments they are not becoming hit in the market. Hmm. This is our innovative Katibasti device. So we had a company, Sarala Siddhi Private Limited, exclusively for the development of Panchakarma instruments. Okay. And this is the first product we have developed. So the name is IKB, Innovative Katibasti Device. It is funded by central government, 7 lakh funded project it is. For startup, they will provide startup 7 lakh fund. So we are private limited company, that's why startup we got the fund. So what are the steps we did? Survey, first Google form survey we did from practitioners whether they need such type of device or not. Nearly 150 practitioners we did the survey, and we found that the price range should be 5,000 to 10,000. Then they can enable 5 to 8,000. Basic device 5,000 without any integration, Android integration 5,000. And we started applied for the grant and we got it. So second step we found what are the gaps in current device. The bulky device we shown in the previous slide. Then what could be the probable solutions? Then idea should be converted into proof of concept. POC it is called. Then of POC, the initial prototype, it will take around 5 to 6 different prototypes you have to make. Then at last you will get, means the temperature is, if you see this device here, it is directly placed on the back of patient for the lumbar area. Okay. So directly it will be placed on that. There are 3 different components. I'm going to show that. So after prototype QC check and functioning prototype, we have to do alpha and beta testing, and then after that quality control check. Then only it should be placed on the patient's body surface. That is trial, clinical trial. So this is the illustrative diagram, how it looks like that. Section wise, if you see this here, it looks like this, and this is 3 compartments are there. Lower compartment over which here is the heater, means heater. This is heater. Middle compartment. Lower compartment, we are going to keep the aluminum vessel or the steel vessel, which helps, means water will be heated here. Indirectly, the oil which is placed, which is there in the bottom surface, which is attached to the patient's surface, it will be heated. Indirectly, it will be heated. This is the concept and the design which is done. So this is the 3D picture. And this is the top view, this one. And this is the side view of IKV. So the challenge is that still we are doing, earlier it is taking time because directly on the over the surface, you cannot use high volt current here. And also DC current is not possible. So the challenge was very high. So it took 30 minutes initially to heat. Then it has gone 20 minutes, 60 minutes. At last 10 minutes it has come. Still we are going for 2 minutes. Till that the machine will not be hit. It is not successful. If the oil heats within 2 minutes, then the instruments is said that can be considered as it is successful and it is ready to launch to the market, ready for launching to the market. Okay. So this is future innovation guidelines for Kativasti, next gen Kativasti device, you can say. So it should have precision temperature control system, multi-point surface temperature monitoring, adjustable retention ring design, leak-proof sealing mechanism, safety auto cutoff system, data logging and AI-based integration, portable compact unit. Then energy efficient heating module. Then automatic oil reheating and recirculation, programmable therapy duration, oil level monitoring sensor, smart touch interface, and hygienic and reusable components. Okay. These are LEPA. You are getting these type of LEPA. Everyone should adopt this Dashanga LEPA, etc. You can make Marmagulika LEPA. Like plaster, ready to use plaster should be designed and developed using the non-allergenic, hypoallergenic patches. Okay. Svedana, these are, steam chamber, sauna. Sauna is initially low investment. It is okay for clinic level. Initially, you can use, but not continuously. You cannot run this device. Okay. You have to give at least half an hour rest. After that, you can use 3 to 4 patients per day, 2 or 3 patients. Okay. These are various Sarvanga Bashpa Svedana Yantras. This is steam chamber with digital temperature controller attached. So you have to smart buy checklist. What is the things you have to see? Safety checklist, whether temperature control system is there or not. Automatic cutoff if overheating is there. Emergency stop switch, pressure relief system. Then material you have to check waterproof body, rust-proof frame, etc. These are very, very, very important. And patient safety essentials are arm support, non-slip flooring, low step height. Okay. Hygiene and cleaning, drain outlet is must. Excess the water, sweat, etc. collected, it should water everything. It should be drained easily. These are steam generators. Steam generator, why you have to check water level indicators, auto cutoff when dry, easy descaling access, single high quality electric steam generator is superior to dual systems. What you have to avoid? Avoid hidden heater system, difficult to repair, and expert recommended don't use dual system generator. This is Nadisveda Yantra. This is again Nadisveda Yantra. Nadisveda gun or steam Nadisveda Yantra. Steam gun. Avgaha. This is one steam generator for sauna therapy. Remote control operated. See, this is available in Amazon. For home use it is. not for clinic use. This is also home use. This is both you can use at clinic level. Facial steamer, facial steamer, facial steamer. This is mist, only mist comes from this. Hot mist for beauty parlor aesthetics means facial. This is nano mist spray, facial steamer. This is Pada Avagaha. You can get it in Amazon and Flipkart, this one. But decoction, if you are going to use filter and you have to wash properly, otherwise fungus will develop. This is for Yoni Swedanartha, for gynecological disorders. This is rectum steam chair. Sauna chamber, Sarvangadhara yantra. Nadi Svedana yantra, what you can do, you can have a temperature, means there should be infrared temperature regulation. If more temperature, it will prevent the sensors will automatically, if sensor is there at the tip of that gun, Nadisweda gun, then if the temperature is more, then automatically it will reduce the temperature. That is the advantage. So that is called precision temperature control system and dual temperature sensing, both outlet and as well as skin contact, both you can prevent, so that you can prevent burns and easy and safe procedure. This is very, very important for Nadisveda. That's called skin proximity detection sensor. So if you go very near to the patient's surface, body surface, then automatically reduce the steam. Such a provision will be there. I will take 1 minute rest for drinking water and we'll come back.
Sir, not audible, sir.
Thanks for waiting. So,
Yes, sir.
the base of the body, there should be multiple sensors needed at the means foot level as well as head level, as the temperature will be highest at the foot levels. Okay. Closed loop PID control system to maintain precise temperature stability. Okay. Dual humidity temperature regulation. So in coastal areas, etc., humidity sensor, it will has the ability to sense the humidity and automatically the temperature will be controlled. Okay. Then personalized therapeutic profiles like pre-programmed mild, moderate, or strong Svedana modes according to the Desha, Kala, Prakriti, Roga. Okay. That you can set like that. Then control heating and cooling curves to prevent dizziness and heat intolerance. So Brahma is the most commonest complications after steam. So that by this using this next gen Bhaspasvedantra, you can prevent this. Then variable steam output modulations. Steam, you can control the steam output also. Real time patient monitoring integration, automated ventilation management. If CO2 becomes more, then it will help in removing that provision should be there. Anti-scald production system, adaptive tolerance algorithm, then session data logging, temperature, humidity, etc. for research and quality assurance. Okay. Even voice control interface, if you provide, then if a patient says, then that can be controllable by that only. Okay. Sarvangadhara, it is the almost same sensors, etc. Only thing here, circulation, the oil circulation and the drip control. These are the most important things. That is called closed loop oil circulation system. Otherwise, and auto synchronized flow pulsation. Everywhere throughout the surface, wherever the drips are there, it has to be synchronized manner. It will occur. Okay. So that should be there in this. Surrounding the same thing. Then Vamana. So Vamana, you are seeing so much of Vamana chairs which are available in the market. How few seats are comfortable to sit? Few seats don't have any backrest at all, neck rest at all. So then how can you can use this armrest? If you see none of the only one, this one is having only one, this one is having wide rest, armrest, forearm rest. Otherwise, all are narrow only. So these are the drawbacks. Okay. So clinic level Vamana chair, how it should be. So biomedical disposal bags, a plastic bucket with lid, waterproof seat cushion it should have. Then smart clinic level improvements. Simple upgrade you can do, slide forward chair tilt, which helps in easier expulsion, adjustable tray height, footrest improves abdominal pressure if footrest is there, and also reduces the fatigue. side handles for weak patients, non-slip rubber legs, mobile holder for recording Vegas. This is a simple upgrade you can do at clinic level. Okay. This is the Omana chair developed by KLE Ayurveda. You know all of you. This has got patent. So this only you can use at the research level and research institutes. But for hospital routine, it is quite maintenance cost is very high. I think sensors because all the sensors are used now. So next gen Omana chair should have ergonomic and patient comfort modifications. So if you see here, so this one here, the neck support is there, foldable head support, adjustable bed rest. This will prevent neck pain, neck strain, as well as mild cervical spondylosis patients also you can easily do. Okay. Vomitus handling and biomedical waste upgrades, smart collection systems, automated segregation concept. So whenever there is a mucus will come, so then segregate that separately, and then pitta starts coming, that is also you can segregate, and only Aushidhi comes, that also you can segregate. Such system should be there for analysis purpose. Then clinical monitoring and digital automation, Panchakarma specific smart monitoring, example number of Vega, time interval between the Vegas, pressure duration. Then AI based observation, AI camera analysis for color grading, means kapha, pitta, etc. or Aushidhi, or mucus quantity estimation, froth assessment, means consistency scoring. Then the fourth point, research and standardization modification. So if you provide integrated sensors, vomitus pH sensor, then weight-based expulsion measurement, digital output dashboard. So Vegas versus time, volume versus stage, and then vital trend during procedure, means BP, pulse, and respiratory rate. What is the trend you can able to see? Emergency and clinical safety enhancements, hygiene and infection control improvements. These are the features to be adopted for next gen Omana chair. This is Omana Virechana chair currently available. See, even they are not provided, the cushion also not provided for comfortable sitting. Also, cushion is not there. No proper armrest. This is the adjustable footrest here. Then slide forward seat tilt. This one. Then side handles. Armrest should be there. This is illustrative one. That wheels with lock. Disposable absorbent sheet under seat here. Okay. This is for research purpose. You can use this one. Then for research level AI based you have to do, that it should have design features adjustable and AI based monitoring and research advantages. So digital stool weight and volume measurement for each Vega interval time, BP and pulse monitoring support. Then AI assisted stool assessment. The AI camera can able to detect, it should detect stool color detection, consistency grading, mucus presence identification, pH also, visual pattern documentation. Then which are the objective assessment tools? Should have built-in pH assessments tool, mucopolysaccharide and sarcobilinogen estimation, digital data recording, standardized outcome documentation. Then research parameters, number of Vega, time to first Vega, initiation, when it is initiated, first Vega, stool quantity and consistency, color changes and mucus presence, pH variations. All these things you can able to document precisely so that you can reduce the observer bias and it improves objectivity in Panchakarma studies, supports high quality publications and multi-centric trials. Okay. This is Basti Karma, Basti Yantras. So you can see this is urinary bladder of animal, earlier days. This is Basti Yantra ready for Niro Basti. This is anima pot or can, anima can, Niro Basti Yantra, automated disease. But now currently it is not available. So these are the different types of enema drug delivery systems. If you see, this is rubber bag. Earlier days in naturopathy, they are using this olden days. Now they are also using the enema pot. So disposable enema kit. So enema syringe and then pressure enema systems. So you can use electronic enema device, pressure controlled. That we are going to see. These are blenders you can use for mixing. Anavasanavasti syringes. This is smart next gen enema device. You can see here smart pressure control. Through this device, you can maintain the required pressure. Then programmable flow regulation. Then temperature stabilization system, pre-mixing and homogenization unit. It should have dose precision model, safety auto cutoff, disposable sterile cartridge system. This is cartridge wherein the mixing, pre-mix, everything it occurs. No? Then digital monitoring display. Then patient profile memory, AI-based personalization, portable and compact design, data logging, biofeedback integration, then auto cleaning and sterilization mode. If all these features is there in next gen device, then it will be very effective, highly effective and safe. Uttarvasti, earlier metal canal is used. Now sterilized disposable IUI are used. Okay. This is IUI. Intrauterine Uttarvasti using IUI. Uttarvasti, Runavasti Yantra. Yonigata Uttarvasti. This is currently available in Amazon. For self is patient. For vaginal douche. Yoni Dhavanartha. All these are Yoni Dhavanartha. Uttarvasti in male usually infant feeding tube is used. Nasyakarma. See now Anutaila dropper you are seeing here on the first. Second thing, nasal spray, Jandu, Anutaila and Shadbindu Taila is available in this. Okay, they are using. And nasal atomizer. Fine mists are produced. Nasal gel applicator, nasal polyp or bleed to arrest the bleeding, etc. Then powder insufflator, Pradhamanasya. It is available. Nasal dropper with calibrated markings. So next gen Nasyakarma device, it should have precision micro dosing control. 0.1 to 0.5 ml. So dual mode delivery. So as well as means drop by drop or avichinna dwara, both options should be there. Closed loop temperature regulation. So multi-point temperature monitoring, programmable dosing profiles, flow rate modulation system, then pressure safety control, auto warming or heat stabilizer, reservoir with smart detection, hygienic disposable nasal tips. The tips should be disposable. Then Rakta Mokshana, this is Shrunga method. The syringe is the end. The tip of the syringe is cut and it is used as a shringa, alternative to the shringa. Whenever shringa is not available, you can use this. Hot cupping, dry cupping, wet cupping, and electromechanical suction pump. This is hijama cupping machine. This is vacuum cup. Then you can microneedling, Suchi type of Raktamokshana, Prachana. This is available Amazon, etc. Siraveda. So this completes the recent advance in Panchakarma instrumentations and future directions as well as R&D development guidelines I have provided. So this is our Atreya Ayurveda Academy YouTube channel. Various Panchakarma procedures have been uploaded. These are few my books, Panchakarma books. Research PG also it is there, UG and research. UG and PG, research book, research and stat. So thanks for patient hearing. Thanks for the organizers also, Dr. Santosh Edali sir and his team. Coordinator, you can start
Okay, sir.
asking the doubts.
Thank you very much, sir, for your enlightening lecture. Now we shall move on to the interactive question and answer session. I request the participants to kindly post their questions in the chat. Shall I start, sir?
Yes, doctor.
Okay, so first question. Does the replacement of manual Panchakarma procedures with automated devices reduce the role of Bishak and Upasthata as emphasized in Chikitsa Chatushpada?
Means what they mean, positive or negative? What they are asking exactly? They can ask, no? The sole intention of developing instruments or devices is to reduce the dependency of therapists and as well as the observation by the Vaidya. Okay, both are there. Both are there because Panchakarma Vaidya, if the pressure is going on, OPD is also, it is simultaneously OPD is also there. Then how can you able to, it is practitioner oriented, not the institute oriented R&D advice. Okay. So ultimately every research has to reach to the end user is practitioner or the home use also. Some instruments will come up in future. It will be used in the home. The crystal mind, it can be used in home. Okay. Few devices we have to restrict for patient. Many devices, few devices we can give liberty for the patient to use at home, which are very safer. Then you can use at the level of home use. So I think the answer is clear.
Yes, sir. Thank you, sir. Next question. Any good vendor for fiber drone as per your recommendations?
SK means Esteem Trishur. That is the top number one in India.
Okay, sir. Can dependence on modern machinery in Panchakarma be justified when classical texts emphasize Yukti, Hasta Kaushala and physician expertise?
That is not matchable. Definitely. Ultimately, patients and I am not told anywhere robotic use of robot for massage. Okay. So Kai Seka, etc. Only flow is there. It is falling, oil is falling, but therapist has to use his hands. For automated Shirodhara also, he can use his hands for scalp massage during the Shirodhara. It is up to the discretion of physician whether therapist should do massage of the scalp or not. Okay. So always there is a free. Okay. Whenever there is a human intervention comes, human touch, always it is the best and it is the most preferred. Okay. That's why nowhere I mentioned robotic. Even in next gen also, I have not used the word robotic. Okay. Ultimately, everything should be finalized by the Vaidya only. Temperature, how much it should be according to the patient. Only things according to the temperature can able to restrict it. Even by misguidance of the patient also sometimes will lead to the complications. Okay. For example, if you have inquired, but he has not told the original Desha, migrated Desha he has told. Then in such scenario, there will be complications. So that is not due to the fault of Vaidya. That is due to the misinformation by the patient. So such errors or complications arising due to such misinformation can be prevented by using these devices, which can be able to control the temperature automatically. Okay.
Okay, sir. Next question. Innovative Katibasti device, how does it works? Could you explain in detail, sir?
So 3 compartments are shown. I think you have shown better. First compartment is the oil you are putting, and second compartment you are keeping a vessel, aluminum vessel or copper vessel if you can use. That's very good. Then the second compartment has you are putting in the copper vessels you are putting water, and just like the heater device has the heating filament or heater that will be dipped in that water. Okay. So regulate in the top compartment there will be control electronic circuit will be there, which controls temperature, switch on, switch off, and auto off. All these controls will be there. So when the water is heated indirectly, the oil will gets heated and the temperature will be maintained as it is closed, and it is the temperature continuous uniform temperature. There is no need of refilling. No need. Uniform temperature will be maintained. For that purpose, it has been built. There are challenges definitely for maintaining uniform temperature also. So whether we are thinking of keeping it open or closed. Closed will causes more temperature gradually increases. So auto means we have a control system. So 45, if you set the temperature 45 or 47, then 47 after reaching that it will auto off. Then if it falls below 40, then again auto on, it will start. Like this, the provisions are there.
Okay, sir. Next question. Sir, can you please share some ideas and inputs for designing standard Pradhamana Nasya instrument which will be cost effective and safe to use? What factors should be considered while designing an ideal Pradhamana Nasya instrument?
So Pradhamana Nasya, as Shastra has told, Sukshma Raja, they are told, nanoparticles. Okay. So based on that nanoparticle size, already I told even it is available, inflator, nasal inflator it is called. So it is easily available. You can use that instrument, no? You can control the dosing also in that. Hmm? Just like rota healer is there. You can use the rota healer also. Rota healer or I shown that also one option. These are already available, currently available devices are there. Only thing you have to modify a little bit, means according to your things. If it is not nano size, then it may obstruct that device. That is a condition, precondition. So these are the very essential things you have to keep in mind while developing a device. And using a currently available device also, that you make sure that it should be, the size should be nano.
Thank you, sir.
Next.
Next question. Whether any Virechana Maniki Shuddhi assessment device developed, sir?
Till now, nobody has developed. They have tried Nagpur, but each Vega they are not able to measure because of lack of that device. Okay, that is the thing. So it is not available.
Okay, sir. Next, again on Pradhamananasya, sir. Since manual blowing produces variable pressure, what innovative instrumentation can be developed to deliver a fixed and reproducible pressure during Pradhamananasya?
Same thing I told no already, Rottweiler, etc. That this is again, they are also manual. If you want automatic with use of pressure, you can use the pressure device. And first you have to study what is the quantum of pressure is needed for that. The manual pressure you have to study first. With the human blow, how much pressure is needed. Study that. The same pressure amount you have to use for the device which you are going to make. Okay. Same thing is adopted for the enema device.
Okay, sir. Artificial intelligence and robotic systems can truly replicate the Vyakti Vishishta Chikitsa Siddhanta of Ayurveda.
Again, I'm telling AI can help and support, minimize the human intervention and controlled procedure will be there. Minimizes the complications if used judiciously and wisely, and it never become alternate to the Vaidya. Keep in mind.
Okay, sir.
Because Vaidya will decide dosha, the variants, Ekadash Pariksha, dosha, Ushata, Deshakala, साथ में सत्वा, vayo, voka, agni, kosta, all these things you cannot. So Vaidya, ultimately Vaidya will decide. So which are all the things you AI can able to do. So ultimately, again, it has to depend on the Vaidya. Otherwise, the top highly skilled Vaidya, if trains the AI agentic through via agentic AI, even then it is not possible AI to replace the Vaidya. That is my challenge. Okay. And also, being an Ayurvedic Vaidyas, we should not go up to that level. That is my personal opinion. We should not go up to that level. As our science is not globalized, fully developed, like allopathic science, so we should not also think in that line. Yeah, you have to limit the use of AI. You have to restrict, limit, and put some ethical boundings for the use of AI. Then only Ayurveda can become, for next generation, it will be fully globalized. Why? The question of job, etc., someone is thinking about that. That is also there. That's why I'm cautioning. Okay. For allopathic, whatever they can do, they will do. Okay. They already, it is developed science, fully developed and globalized. And their lobby is very high compared to ours. Okay, that's why even if it is possible also, but it never replace an Vaidya. It never become an alternate to the Vaidya. That's my assumption as well as
Thank you, sir. Next, using the traditional Kalva yantra and using a mechanical mixer.
difference you can see now we are using both. Whenever you have the facility, you can use. If you have more number of patients, you can use the mixie also or blender you use. Mixer will produce more froth, fena dosha will be there, vayu dosha. So you have to wait for that. So again, you have to find a way to prevent the occurrence of this foam or these things, bubbles, everything. Then only you can use the mixer. Otherwise, you can use blender. Blender will produce less foam compared to the. Then wait for that. That can be easily removable. No, the emulsion studies have been done. So ultimately, the handmade one means Kalva Yantra is producing highest stability of the emulsion, no doubt, but it will consume more time. Okay. So according to your time and emulsion, whatever, whichever the way you prepare, emulsion should be strong, stable. That's all. If you keep for 15 minutes, 10 minutes, then the different layers are seen, then it's of less effective. Okay. Whichever the way you prepare, the 3 tests told by Chakradatta, that should be applied along with this emulsion, strong emulsion. That is the final rationale to use which device for mixing.
Thank you, sir. Next question. What is the effect of nozzle design, diameter, length, and angle in Pradhamana Nasya procedure?
Device,
Yes, sir. What is the effect of nozzle design, diameter, length, and angle in Pradhamana Nasya procedure?
so whatever the classical guidelines they have provided, the same thing should be adopted here. So if you are reducing the length, then pressure also you have to reduce. Okay. So first let us devise the device based on the classical recommendation, the length, everything. Okay. Then only you can use. So I have not used none of these devices. I'm telling you, frankly, we are using a simple straw. Okay. And very rarely we are using Pradhamanasya. That's why no, dear, we are not so much eager to develop this device. So academic purpose, you can develop that device. Okay.
Yes, sir. Thank you, sir. Next question. Does use of more plastic, rubber, silicon-oriented material in automated devices increase the exposure of body to microplastics?
So it depends. Silicon is different. Silicon is not plastic, you know. Silicon is always the most widely used in the medical devices, medtech as well as food tech also. So you can use it without that one. Plastic containers you avoid. You can prepare in that, no? Okay.
Thank you, sir.
Avoid
Next,
plastic. Use silicone. Silicone you can use. Silicone is costly compared to the plastic. Okay. Even steam chambers you are using, facial steamers you are using plastic one, no? That also nanoplastic will enter into the lungs. Okay. Next.
thank you, sir. Next question. According to your clinical experience, is it preferable to perform Panchakarma procedures using modern instruments or the classical method? Do both approaches produce same outcomes?
Outcome will be definitely, if you use the advanced tools, the outcome will be far more better than the current or traditional ones. Okay, definitely, no doubt. Next question.
Yes, sir. Sir, can we evaluate and compare the drug dispersion or absorption achieved during male Uttarabasti using an infant feeding tube or a Foley's catheter through dye studies or imaging techniques? Please share your opinion over this.
Definitely, imaging techniques already, I think someone has done in Jamnagar. 2 studies have been done. Neurovasti, up to which area it will reaches. So splenic flexure, up to that area it has gone. Up to that area it has gone. You can see the study. Yashwant Juneja et al. 2009, Jamnagar. It is there. Uttarabasti, I don't know. That can be done using the radio opaque dye followed by simple erythrogram, which is used for the that will be. Next question. Who are these offenders disturbing the session? Next question, doctor. Finish it as per.
Next question. In your clinical practice, whether you will assess Maniki Shuddhi of Virechana? If yes, how? If no, then whether there is no importance of Maniki Shuddhi in Virechana, sir?
Maniki Shuddhi, definitely, just like Vamana, we are assessing the Vega. So Vega standardization as per the Sachin Chandalia sir study. We are assessing. No, Vamana, we are applying same thing we are following. So each and every Vega based on your you are not measuring. Based on your experience, you can able to say the same thing should be trained for patient. Okay. Is the quantity is less than 100 ml or more than 100 ml, 50 ml, like that. Some quantity, general idea will be there. No, based on that, you have to use Manik Shuddhi as a for considering counting as a Vega or Upavega, like that. In Virechana also, it is possible if you train the patient. Otherwise, you have to use cameras. Okay, that is the only idea. Okay.
Thank you, sir. That brings us to the end of the question and answer session. Thank you to everyone who participated by sending thoughtful questions. As we come to the end of this session, I warmly invite Dr. Shilpa Shri ma'am to deliver the vote of thanks.
Good afternoon, everyone. It is my privilege to propose the vote of thanks for today's enlightening webinar on emerging research trends and instrumental innovations in Panchakarma, conducted under the webinar series Karma Chinta, organized by the Department of PG Studies in Panchakarma, TGMC, Ballari. First and foremost, I express our sincere and heartfelt gratitude to our esteemed speaker, Dr. Vasant C. Patil, sir, for delivering such an insightful, informative, and inspiring session. Thank you, sir, for sparing your valuable time and sharing your expertise with us, sir. Next, my sincere thanks to our respected principal, Dr. Janaki Y.S. Madam, for her constant encouragement and support. And I extend my gratitude to our respected HOD, Dr. Santosh Edalli, sir, for organizing this webinar series. And I sincerely thanks all faculty members, organizing committee, technical team, and all participants for their wholehearted support and active participation, which made this session a grand success. Thank you everyone for joining us. We look forward to welcoming you again for our future academic programs. Thank you one and all.